Hello and welcome back to my channel. Today's topic is urinary tract infections in women.
Urinary tract infection. What is it? What happens in a urinary tract infection? What are the symptoms? Why are women more affected? How to prevent it? In this video, I will answer these questions in a detailed and easy-to-understand way. And before we move on to the content, I ask you to subscribe to the channel. It helps me a lot and motivates me to bring more interesting content about health. So let's go. What is it? A urinary tract infection is a disease caused by the presence and multiplication of microorganisms, usually bacteria, in any part of the urinary tract. Urethra, bladder, ureters, or kidneys, causing inflammation and urinary symptoms. The urinary tract infection corresponds to the colonization and inflammation of the urinary system by infectious agents, most often bacteria such as Escherichia coli. What happens in a urinary tract infection? In a urinary tract infection, bacteria, most often Escherichia coli, enter the urinary tract through the urethra, multiply, and cause inflammation. This generates symptoms such as burning when urinating, frequent urge to go to the bathroom, and, in more severe cases, fever and lower back pain. Today I bring you cystitis, urethritis, and pyelonephritis. Cystitis. This is the infection of the bladder. It is the most common form. The bacteria that enter through the urethra reach the bladder, adhere to its walls, and begin to multiply. The inflammation resulting from this invasion causes the classic symptoms of pain and urinary frequency. Urethritis. Urethritis is an inflammation of the urethra, usually caused by sexually transmitted infections, such as gonorrhea and chlamydia, but it can also have other origins, such as viruses, fungi, trauma, or the use of urinary catheters. Urethritis causes symptoms such as pain or burning when urinating, urethral discharge, clear, whitish, or purulent, itching or discomfort in the intimate area, frequent urge to urinate, and in some cases, blood in the urine or in the discharge. Pyelonephritis. This is a kidney infection. It is much more serious. It occurs when the bacteria from cystitis are not treated and ascend through the ureters, the tubes that connect the bladder to the kidneys. A kidney infection can cause permanent kidney damage and lead to a generalized infection, septicemia, if not treated quickly. The symptoms usually caused are high fever, generally above 38 degrees Celsius, lower back or flank pain on one or both sides, chills and shivering, general malaise, fatigue and weakness, nausea and vomiting in some cases, abdominal or pelvic pain, burning when urinating, frequent urge to urinate, cloudy urine, strong odor, or presence of blood. And now, why are women more affected? Well, female anatomy is the main reason. First, the urethra is short. The female urethra is significantly shorter than the male urethra. This means that bacteria have a much shorter distance to travel to reach the bladder. Second, proximity to the anus. The opening of the female urethra is very close to the anus, which is the main source of the bacterium Escherichia coli. How to prevent it? For women who suffer from recurrent urinary tract infections, prevention is a daily effort. Hydration. The goal is to have light-colored urine and a constant flow. Every time you urinate, You are mechanically flushing out bacteria that try to adhere to the bladder wall. Emptying the bladder properly. Urinate whenever you feel the urge, and try to empty the bladder completely, but don't rush. Intimate hygiene. Soaps. Use neutral pH soaps or those specific for the intimate area, and use them only externally. Avoid perfumed or harsh soaps. Vaginal douches. Highly discouraged. They clean the protective vaginal flora, opening the door to Escherichia coli. Baths. Avoid prolonged immersion baths with foams or bath salts, which can be irritating. Diet and supplements. Cranberry. The evidence is mixed. It does not treat an active infection, but it may help in prevention. It contains proanthocyanidins that, in theory, make it harder for Escherichia coli to adhere to the bladder walls. Many juices have too much sugar. Concentrated extract capsules are generally preferred. D-mannose. It is a type of simple sugar that has been shown to be effective in preventing urinary tract infection. Escherichia coli attaches to D-mannose, which is then expelled in the urine, instead of attaching to the bladder wall. Probiotics, especially those containing strains of lactobacillus. They help maintain healthy vaginal flora, creating an acidic environment that is hostile to Escherichia coli. Vaginal estrogen in postmenopause. For postmenopausal women with recurrent infections, the doctor may prescribe a low-dose vaginal cream, suppository, or ring with estrogen. This restores the health of the vaginal flora and the thickness of the urethral wall, making them more resistant to infection.
We've reached the end of another video. I hope you enjoyed the content, and please don't forget to subscribe. Goodbye, take care.